Hey, Pusnet, new little video. On this one will be a concept video, and it's a little idea that I just got. Usually on my days off, I'll read in the morning mostly, and on different subject and stuff, but mostly for work. And I just finished watching a presentation on a medical conference, and I got kind of a little flash, and so this is why I wanted to share with you, and as a concept, so it's not fully developed yet, but I think it's worth thinking about it. So it's about capnography, but from now on, or the poor man ICU, and ICU stands for intensive care unit, and I'll mention why with this. So it's a little device that reads what we call end-tidal CO2, and from the now on I'll mention end-tidal CO2, and so it's for end-tidal, so that means at the end, and the CO2 is for carbon dioxide, which is what it's not to confuse with carbon monoxide, which is what we breathe if in the fire and something. But carbon dioxide, CO2, not CO, is what we produce. So when we take an inspiration in, oxygen goes in, and what we expirate out is carbon dioxide, so CO2. So what this machine does is basically monitor how much CO2 we produce. So why would that be interesting, and why do I talk about that stuff? Many times on the channel we talk about how in a self-reliance situation, one of the issue when you're outside a hospital setting is having all the technology they have, and because it's very expensive. So for example, a monitor where you would be having to monitor like a cardiac monitor or something like that can be in the 10,000 if not more, especially the portable ones. And not only that is then you have to have someone with knowledge to interpret what you're seeing. So and they're very heavy, so they're very, even the portable ones, they're not that portable. I mean, they're a few pounds, and so it makes it not that easy for people that wants to be ready and self-reliant to have something like this. And so I was looking at a presentation, and I kind of got the idea. A lot of time I talk to, when I have like students or people that I mentor new nurses, I always tell them that if I would have to have one device, and one device alone, that I would need to monitor my patient, that would be the device. And so what device are we talking about? This is what it is. And I'll explain to you how it was. So why would it be relevant here? So first of all, it's battery operated, so that means that if you have a way to recharge battery, you could use that. And it's a little bit, it looks a little bit like, it's about the size of an old cellular phone, you know, like from the 80s, you know, those big telephone. That's about the size of it, and a little bit the weight, a little bit less heavy, but that's what those devices can do. And so why would it be important to have one of those? So as you see, it's affordable, and it can provide a lot of information. Versus why this versus a saturation monitor. In the past, I mentioned that in my wilderness first aid kit, I carry a saturation monitor, and it has his place. But the problem is there's a limit about the information that you can gather. And I don't want to go too much with this video, but if you have poor perfusion or things like that, your numbers will be skewed. Versus an end-tidal has more information, and is a little bit more relevant to what we're going to talk about. So how does those device works? So like I was saying, when we breathe in, we breathe oxygen. When we breathe out, we breathe CO2. So what does device do? And you can see here, it makes this little waveform. And when you have a monitor on it, that's what you kind of see. You see a little waveform, and you'll see a number as well. The number is not as useful, but it can still help a little bit, and I'll mention why. But it's mostly the waveform that is interesting to for what we want to do it. So when we expire the entire CO2, it monitors that and can do. Most machines have people when we use it, it's mostly for intubated patients and stuff. But lately, the technology I got better, and you can use it with conscious patients, so patients that had talks and everything, and with a nasal prong. So basically, you put just like when you have a little bit of oxygen, and it's a little cannula, and just by the air that they breathe out of their nose, you can monitor this entire CO2. So you don't need somebody intubated and stuff. Obviously, intubation is a little bit more accurate, but still with the nasal prong and stuff. So why would I need waveform, and what kind of information it gives me? So here's a little bit where it gets into the anatomy, and I don't want to get too much in this. It's not a nursing course, but this is what the information stuff. So as you can see over here, it says VQ, normal VQ. V stands for ventilation, and the Q stands for perfusion. So this is what this device helps me. So what you got here is capillaries, and that little round bubble there is a alveoli. So when most of our lungs, if you remember your basic biology class, looks like a reverse tree. So basically you got a lot of branch, and at the end you have those little balls that looks a little bit like a grape, and this is where the oxygen gets exchanged. So basically the oxygen comes from the top of our mouth, goes all the way down there, and then gets distributed. At the end of those little balls, alveoli, or those little grapes, there's a little blood that comes there, and this is how the oxygen gets exchanged. And it's a little bit of an exchange, as the alveoli gives some oxygen, and the capillary brings the CO2, so that we expire out, because if we have too much CO2, we die. So why would this machine be any helpful in what I do? In the middle here, you see that there's there's no black spot. Black spot means there's a blockage. And this is where the magic of this machine does. So in the middle, it's a normal thing. So that means that there's a good circulation and there's a good ventilation. Oops. On the left side, this one over here, there's not a good there's a good perfusion, so that means the blood circulates normal, but there's not a good oxygen exchange. So it can be that you got a pneumonia, it could be that you got a bronchospasm. So for example, if you have asthma, it could be a whole bunch of things that prevent the air either to come in or to come out. In this case, the entire, because we check the air out, it prevents this CO2 that is here to come out, but the oxygen gets over there. So then your numbers will be lower because it reads the machine at the end. So for example, if I read my machine at 45 and I get something that blocks the numbers will come down, the number will drop to, let's say, 35. So that means something has happened to my lungs. On the right side, so this side right over here, so this one over here, what happens here, it's the blockage on the perfusion. So that means it could come out and there's oxygen that could come in, but for whatever reason there's either bad perfusion, there's vasoconstriction, meaning that the vessels shut down, there's a pulmonary embolism, so there's a little clot in there, but the perfusion is not going in, and so it cannot bring the CO2 to the alveoli to come out. So very technical, but why is that matters? As you can see here, this is where I was talking about that waveform, and this is where this is the concept that I want to talk. So that means that if I have someone with this machine and I can see those waveforms, if I print something like this and I can have someone that is not medically trained, they can have a pretty good idea of what's happening with someone. So for example, if I bring your attention to this one right over here, that means you have your little cheat sheet, so a sheet just like this, and you look and you see that the waveform looks like this. Look what it says here. It says bronchospasm. Bronchospasm means that it's an asthma attack or a reactive airway. So that means that the airway has constricted. So that means that you would need Ventolin. If, for example, no, they don't have it, but if, for example, another example, if this happened here, where you have a nice waveform and then suddenly going down. So here they say hypoventilation, and this is where there's a little bit of knowledge that needs to come in. Well, if this goes down, but the person is breathing normally, that means their perfusion went down. So that means they could be going on a shock or something, or they're losing blood. So as you can see, with very easily management, obviously, just like knowing how to suture or knowing how to staples and stuff, there's a little bit of knowledge to it, but with a very small amount of teaching, a relatively, I mean, for $200 investment, plus you would have like, so yeah, about 250 to have a few of those, and they can be reused, have some of those nasal prongs. That means you can have a very portable device that can gives you some information about what's happening inside the body, about perfusion, ventilation, if I need to give some medication, if things are going worse. That other thing too is that, as you can see on this one here, it says apnea. And so what happened is that, for example, if the line goes down, the monitor will sign up. So imagine that you have someone that you cannot really, you have you're a person that you have to take care of, and you want to make sure they breathe, and for whatever reason you don't want them to suffocate. Well, if you put this monitor, this is another advantage versus a saturation monitor. People will keep their oxygen level pretty high even if they start breathing, up to about 10 minutes. So you wouldn't know about 10 minutes, but this person, as soon as it stopped breathing, the machine will tell you. So for example, if you're sleeping beside whoever you're taking care of, the alarm would ring and it tells you that this person has stopped breathing. So then you could go push them, do whatever you have to do to stimulate them, or try to do anything to try to make them breathe again. So as you can see, a lot of possibility, and this sheet is one side of many other possibilities that you can have. All this from a device that costs about $250, very portable, and is AA battery operated. So that means any device that you have and stuff, and rechargeable. So that was the concept of it. It sure was a little bit technical because it the VQ mismatch and all that stuff, so the ventilation and perfusion mismatch. But as you can see, that means that you can monitor almost as well as hospital, take better decisions on having a cheat sheet like this that you can print out of the internet, and just by recognizing what the waveform looks like. So even like having that thing right beside, you could have like it tells you exactly what's going on and everything. And add to this a small small saturation monitor, and you can, as you can see on this side, it says SpO2, which is the saturation monitor, normal or decrease and stuff. So basically, if you have those two numbers, you can have a pretty good idea what's going on and help you in your decision. Should I move? Should I bug in, bug out? Because obviously, again, our role here is not to make you little doctors or anything like this, but it's to help you make decision and give you tools so that if something happens, should I take the risk to move my whole facility or move that person through a crowd all the way up to the hospital where there's a higher risk for either a pandemic or something like that. Anyway, that was the concept. Hopefully you like it, and I'll talk to you soon.